Okay, Phyllis Bensoussan is joining us this morning. I'm so happy to have you on air. How are you doing with regard to the fast?
Well, it's basically just begun, so far so good.
Okay, well, I think it's a pretty long fast, but definitely worthwhile. Okay, so Phyllis, when somebody comes to get a hearing test, I'm sure a lot of people are very nervous at the beginning. They don't know what to expect. They don't know how they're going to feel. So what do you expect at a hearing test, and what is the procedure basically?
Mm-hmm. Excellent question. You know, there is the test itself, but that's probably the least important part because it's just a test. Anybody can do the test. What's important is really understanding and connecting to the person that is in front of me, the patient. I have to know who I'm dealing with, what their needs are, what their struggles are, in order to be able to give them the solution that they're looking for or to help them understand that they do need a solution. Sometimes that's part of it, but it's all about really getting a good history and a good understanding of where the problem actually is.
When you have a hearing problem, is that something that comes from family? Like you'll see a generation past where, you know, your family maybe one of them had hearing problems, but you don't, but maybe your children do. Is it something that's passed on?
Yes, 100% it can be passed on, and that's probably one of the most common types of hearing loss that I see are people that are just getting older, and depending on, you know, your genes and what happened past in your family, certainly it's passed on. But there are also other factors that contribute. So yes, during the testing, we can tell what type of hearing loss it is and where the origin of the hearing loss is, and if it's a nerve hearing loss. And all of that is very important, and what can be treated other than with hearing aids and what can't. But for the majority of the hearing losses, usually it is a nerve hearing loss, and therefore there is no treatment other than hearing aids. That is the treatment. So,
okay, let me ask you this question. There are all kinds of problems that people have that are equated with hearing loss. The solution that you give them with a hearing aid, are there different kinds of hearing aids that target different kinds of losses, or are they all basically the same?
No, there are certain hearing losses that need a specific type of hearing aid for sure. And then there are some hearing losses where you can really wear almost anything, and then it would depend on how a person feels in terms of how much they want it to show or how discreet they want it. It also has to do with a person's dexterity. You know, when you get to very small products, they have to be able to handle it and change batteries and, you know, maintain it properly. So that's why I say it's so important to look at the whole patient, their age, their dexterity, what's important to them. Is size important? Does it not matter? Is the cost important? You really have to understand, because, you know, for someone where the cost is a big issue, you don't tell them the most expensive hearing aid. That makes no sense. You have to go according to the need of the person in front of you. That's why that initial discussion, in my opinion, is the most important part. And then, of course, we follow it by a detailed test, which gives me all the information I need to do the proper prescription. But I can't do the right prescription unless I really understand the person in front of me. And that is why patients often ask, why can't I just order this online?
Oh, really?
Why can't I just,
Kidding.
Hearing aids online? But who is going to understand what you need? It is not just pick whatever you want. Let's order,
Right,
like you're
absolutely.
ordering an appliance. It isn't.
Well, you have to admit that things have changed for the better in this time. I mean, a hearing aid was one hearing aid years ago that probably fit everybody, but didn't fit their lifestyle or the problems they have. But today, it's such an educated and such a sophisticated, world in hearing aids where, one size does not fit all, but there are so many different hearing aids for different people, and it's normal today. It's not something to be frightened of. It's not something to be. It's like wearing glasses, the same kind of thing. Would you agree?
Absolutely. And when patients are concerned about the way it will look, and I show them how small it is and how it sits on the ear in such a discreet way, they're really amazed. And that takes off that worry that it's going to be seen. It's very discreet. And I do remember when it was one hearing aid, because when I started practicing in New York, that's what we did, one hearing aid back in the day until we knew better. And we know better now because there have been multiple studies to explain why you need two hearing aids. So, yeah, it's come a long way.
Well, I think that, going to see someone like yourself, Phyllis, makes it a lot easier. A lot of people are very nervous about getting a new hearing aid or even sharing that information with anyone. But right now it is common that people will be afflicted with hearing problems. And thank God for Phyllis Bensoussan, who's there to make life a lot easier for all of them. Thank you, Phyllis, so much for sharing your information. Have an easy fast, and we'll look forward to talking with you again.
Yes, thanks so much.
Take care.
Bye-bye.
Bye.